Thank you very much. My name is Adrian Dix. I'm BC's Minister of Health. Beside me is Dr. Bonnie Henry, our Provincial Health Officer. We're honored to be here on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nation, and I wanted to introduce Dr. Henry.
Thank you, and thank you very much. Much has happened in the last 24 hours, as I'm sure you're aware. I do want to start by talking about our new cases, and we have 7 new cases to report today, so our total in British Columbia as of earlier today is at 53. Most concerning for us is the fact that we do now have a second long-term care home that has an outbreak that is involved with COVID-19. This was an outbreak, as you are aware, it's the end of our influenza season, and we have been having influenza outbreaks in long-term care homes, as we expect to see during this season. And this one was thought to be an influenza outbreak as well, and it turns out that one of the residents who was tested, out of a number that was tested, a man in his 90s who's a resident of Hollyburn House in North Vancouver, tested positive for COVID-19. And in addition, it was apparent that a number of the healthcare workers at that facility were also linked to the Lynn Valley Care Center. And so we have 2 additional healthcare workers who have worked at both of those facilities who've been identified through the outbreak at Hollyburn House. And they are a man and a woman, both in their 40s, and they're both in isolation at home in the Fraser Health region. So obviously we are continuing the investigation both into the Lynn Valley Care Center and now the connections with Hollyburn House. And we talked yesterday about the fact that we do have many people who work in many different facilities, and that has been part of the investigation to track down. So these investigation and the investigation of the second outbreak, which was thought to be an influenza outbreak, converged with the understanding that this was COVID there as well. We are, of course, continuing the investigation into all of the healthcare workers, and I know there's been more testing that's happened at the Lynn Valley Care Center, and additionally there's been a number of other residents who tested negative for COVID-19 at Hollyburn House at this time. We have another 4 cases who are in the community, all of them in Vancouver Coastal Health. 3 of them are travel related. One, a male in his 40s who traveled to the UK, primarily London and Scotland. And we have a couple in their 40s, a male and a female, who are additional cases who were on a travel to on a tour and a cruise on the Nile in Egypt. So that again increases the number of people in our province who've been associated with travel to Egypt. I think, obviously we're continuing to monitor. Sorry, we have one additional male in his 50s who we have not yet determined the source of his, where he picked up COVID-19. So he's another of our community cases, and he is in the Vancouver Coastal Health region and is in stable condition at home in isolation. We remain at 1 person right now who's in hospital, a woman in her 60s in Fraser Health, as we mentioned yesterday, and she is in stable condition. And on a positive note, we have 2 more of our cases who are fully recovered. So we now are up to 6 of our 53 cases who have met the criteria, both symptoms and have testing that means they're no longer infectious to others, as far as we know. So many things have changed in the last 24 hours, and I know you're aware of things that have happened globally, the issues that have happened in our neighbors to the south in particular, and it's become apparent that this is a rapidly changing situation again, and the risk for us in British Columbia, while it hasn't changed a lot here in BC, the risk has increased all around us, I would say, and our understanding of the situation has also changed. So there are a number of things that we have been discussing today, and measures that we feel are appropriate at this time that will be taking and announcing today. In particular, we are advising British Columbians against all non-essential travel outside of Canada, and that includes the United States. I think this is really important. It is clear at this time that the evolving situation, both in the United States and globally, is a risk for all of us, and we are strongly advising people not to travel. If you do travel, anyone who chooses to travel outside of Canada will be required to stay away from work or school for 14 days on their return. We feel that this is the appropriate measure at this time, given the situation that we've been seeing, given the importation of travel-related cases and the challenges that we have in monitoring them. I will also say that we had many conversations today with my colleagues across the country, and the situation, particularly in Quebec, which has just come off their March break, where they had a lot of travel of students and others to France and other places in Europe, where, as you know, the outbreak has really exploded in many countries there. While I have full confidence that it will come under control, the situation is just too risky right now. And for people who feel that that is a risk they're willing to take, that is their decision. But we need to be able to ensure that our schools and our workplaces remain safe here in British Columbia now. The other thing that has become apparent is with the increasing transmission of COVID-19 at mass gatherings and events, and we've heard of many of them, including one's large event in Toronto where people might have been exposed. We had a person who became ill while at a large conference here in Vancouver, and that was concerning to people, even though the risk is very low. With the escalating risk of this community transmission, we have to do our best to slow this COVID-19 infections here in British Columbia and to protect people in our communities. So we are directing all event organizers in British Columbia that they will be required to cancel any gatherings larger than 250 people. And 250 people is not scientific. We talked a lot about what are we talking about. Why wouldn't we go with 1,000? And that's what's been used in some places in the U.S. and some places in Canada and other parts of the world. 250 has also been used, and it's not, again, a scientific number, but it is a number that we think has some rationale to it, in that over that large group, it's really challenging to put into place those social distancing measures that protect people and prevent transmission of respiratory infections. And those are some of the things that we talked about yesterday, being able to be at least an arm's length distance from each other, having the ability to clean your hands regularly. And so these are the things that we are now saying all of us have to take a part in. And we are looking at event organizers, whether it's community events, whether it's large events, to look at alternatives that they can use to keep that connectedness and the social cohesiveness. And that may mean, in some cases, having events where you can have a smaller number of people, reducing the number of people who come, separating them, making sure that we make allowances and allow for people who are more vulnerable to having severe infection or from dying from this to not attend events, making it easy for people to cancel out of events. And I have heard from many, many event organizers that us making this recommendation makes it much easier for them to take those measures that we need them to take to protect our health. We will be working, so what we aren't saying is that, any building that has 250 people in it should be closed. Although we are telling workplaces now to start thinking about how to increase distances within your workplace, or make sure that people can do things like working from home, if that's a possibility, or holding virtual meetings, not coming together, not traveling together. Will be, so if we're talking about a Walmart, for example, where there might be 250 people, but you're still able to take those social distancing measures. You don't have to be next to somebody. You don't have to have that close interaction. You are able to cover your cough if you cough. We'll be working with post-secondary schools, with government of BC. We'll be working with the Ministry of Education and others across across government to ensure that we can handle these measures within those settings appropriately. We also, at this time, are not taking action. We don't believe it's appropriate at the moment to close schools. They are, as I mentioned yesterday, a place where young people can be kept safe from a lot of things. They can learn about social distancing. We need to understand more about the role of young people in transmission of this disease. And we know that sometimes that the impacts of closing schools, particularly abruptly, can cause a lot of societal disruption and economic impact. So we want to be doing that in a measured way. I also want to say that these are measures for now. They're not forever. These are things that we think are incredibly important for all of us in society to think about as ways to stop this spread, to slow down. You've heard people talking about, I've talked about, flattening the curve so that we can prevent transmission to those who are most vulnerable to severe illness and death in our society. We can protect our healthcare system. We can protect our long-term care facilities from infection. We also recognize that this is our best advice today, and it has varied quite a bit from what I talked about yesterday, and that is taking into account as best we can what is going on around the world, what is going on in our own context, in our neighbors' context. And this is something that we will be reviewing daily. We'll certainly be reviewing our position on schools. We know that March break starts at the end of the day tomorrow, so we have a period of time where we can be thoughtful, we can investigate the issues around schools, we can talk with the stakeholders and make sure they know we know what is the best thing for us to do in the coming days to weeks as the situation continues to change around us. So these actions, as I said, are for now. And we will be reassessing both daily and weekly, and we'll be here to talk to you about those too. I believe these actions are necessary right now to slow down the spread of this disease and to protect the health of our communities and everybody here in British Columbia.
Thank you very much, and thank you, Dr. Henry, for all your ongoing work, and which represents the work of many, many people out in the community right now who are supporting our efforts to support people who have tested positive for COVID-19, but also the entire community as they deal with these issues. So I want to reiterate the key decisions that we've made today. First, that we're not allowing events of over 250 people, that this number was selected, not, as Dr. Henry has suggested, on a strictly scientific basis, but we think it's the right number and the right judgment amongst the choices we could have made to ensure that people can engage in appropriate social distancing. Secondly, we're recommending against all non-essential travel outside of Canada. That means no quarts of milk in Bellingham, no trips to Disneyland, no trips to Paris or Berlin or Boise. And anyone who chooses to travel outside of Canada, anyone who chooses must stay away from work or school for 14 days upon their return. That responsibility is what we owe to our fellow citizens. Clearly, the issues of post-secondary education and education are important. We feel it's appropriate for schools to remain open now, but we are going to use spring break. I know the Ministry of Education and others will use spring break, and the Ministry of Health and the provincial health officers to consult with stakeholders and decide the appropriate policies and procedures that should occur for students and for staff upon their return. I wanted just to note with respect to the new cases that there are 7 new cases today. That makes 53 across British Columbia. Just to put this in context, I think it shows the evolving nature of the issues, that 5 of those involve travel to China, 16 of those involve travel to Iran, although not in the last few days, 1 travel from India via Hong Kong, 1 from Washington State, now 6 from Egypt, 10 involving the broader thing around the Lynn Valley Care Center, 3 involving the Grand Princess Cruise, and others involving Germany, Italy, and one's community cases that came to us through influenza screening that we do and that are currently under investigation. That's 28 in the Vancouver Coastal Health Authority, 23 in the Fraser Health Authority, 1 in the Interior Health Authority, and 1 in the Vancouver Island Health Authority. I'd also say further that tomorrow morning at 9:30, will be posted on the BC CDC website the number of tests that have been done in British Columbia this week. That number has grown dramatically over the past week. Last week when we announced on Friday, or we showed that on Friday, it represented more than had been done in the previous 4 weeks. This week, more than had been done in the entire period from January up to last Friday. This shows significantly our ongoing efforts to contain and to slow COVID-19 in British Columbia, and reflects the commitment that was made when we started our emergency response 6 to 7 weeks ago. I want to comment on issues around 811. First of all, to say that the people who work at 811, the nurses and other team that works at 811 are doing an extraordinary job. I just want to put in context what they've done. Yesterday, on an average day, they receive between 1,000 and 1,100 calls in a normal course of the year. Yesterday, they received and answered 3,795 calls. And we are working hard. Obviously, there was more demand than that, but we are working hard to deal with even higher call volumes by adding resources. I know that this can be frustrating to people. We ask them to be patient, but this demonstrates the diligence and the work being done for everyone at 811, and like everyone else in the system who's working on these issues. It is, I think, a considerable achievement. We need to give them more resources, and we are. Avec les circonstances mondiales changeantes de l'épidémie de COVID-19, y compris la déclaration de pandémie de COVID-19 de l'Organisation mondiale de la santé et les risques croissants de transmission de la communauté lors des grands rassemblements publics, nous annonçons aujourd'hui que nous avons recommandé à la Fédération mondiale de curling de reporter le championnat du monde de curling féminin 2020 à Prince George. Je pense que I just wanted to note that we've also earlier today, recommended, it was Dr. Henry's recommendation, that the World Curling Championships in Prince George, the World's Women's Curling Championships, be cancelled. Nous sommes aussi en train de prendre 3 positions nouvelles pour la province, c'est-à-dire que nous allons bannir les rassemblements de plus de 250 personnes en Colombie-Britannique, que notre recommandation, c'est que personne ne voyage ailleurs qu'au Canada, et que si on voyage ailleurs, qu'il faut rester seul, s'isoler pendant 14 jours. C'est-à-dire que ce sont 3 mesures importantes pour assurer que tout le monde reste, la santé de tout le monde est protégée.